the rationale behind it was always we need to keep people alive long enough to get them into treatment.
Right.
And I saw there was a big concerning trend that is really amounting to normalizing drug use as a lifestyle. And I don't think that's helping communities.
Right.
And I think that the federal model over much of the last few years we've seen fail.
Hi, I'm Mike. The scourge of addiction is one of the most prominent issues in modern Canadian society. The ideological and political battles, though, have hindered our ability to address addiction. In this segment with Andrew Lawton, we discuss some of the difficulties in serving those in crisis. Have a listen. So obviously here at the Annex and the Grace Cafe, one of our biggest concerns is housing.
Mhm.
Now, I know from a federal level, for the most part, they rely on local governments to administer the funds that are put out. You have a couple of areas that have been suffering hugely from the homelessness problem. What is the view from the federal level? I mean, when you take a look at St. Thomas in London, are you happy with what's being done, or is there a plan to do things differently?
So I'll say one thing on level of government, because we do have to respect that there is a jurisdictional difference, and healthcare is this and immigration is this. But when people see problems in their community, they aren't thinking of which level of government. They just want it to get done.
That's right.
And we're seeing on a lot of issues, and housing is probably one of the biggest, where no one level of government has the monopoly on it. We're never going to solve a problem as complicated and as pervasive as homelessness without all levels working together. St. Thomas is an interesting one because on one hand, we're doing everything right as a community. We have a mayor and Joe Preston and a council that are very aware of the problem. We have a city with a very ambitious goal of eliminating homelessness, and metrics on paper show us moving towards that.
Right.
But the perception of people that walk down the street is that it's getting worse.
Right.
And we're seeing a problem across the country. It's not just St. Thomas, where people are seeing these issues in their communities. There's a public safety component, there's a justice component, there's the addiction and mental health aspect. And I think in some ways we need to understand where the divergence is between what's happening on paper and what people are seeing on the street. And I think that one of the great things we've done here in St. Thomas is, well, I'll tell why we've been able to do what's happening in St. Thomas is because we're big enough to have the resources to get things done, but small enough to be unencumbered by some of the bureaucracy that really plagues larger communities.
Yeah.
And you look at how Indwell is partnering with different levels of government, from CMHC right down to the municipal level. But you also can't look at it as being a government-only solution. And I think what you're doing here and the Grace Cafe and the Annex are great examples of this, where civil society groups, faith-based organizations, just individual people play a huge role. And I think the worst thing that a government solution can do is not acknowledge and really take in the boots on the ground and the local perspectives that are going to differ from community to community.
Right. It's awesome. So you mentioned addiction as being one of the most serious problems. Obviously, we would agree with you on that. Ontario has taken a step back from the harm reduction approach and is going to a more recovery-based approach. From the federal perspective, again, what does Ottawa think when it comes to recovery? Because it's not getting better out there generally.
So I will say this is an area where, to go back to my earlier point, you're going to have different views on how to get to the destination.
Right.
And if I could just take a step back, because I first encountered this discussion when I was working in radio, and we saw London really become a hub for a lot of the problems that we used to see as Vancouver problems. And now it's trickled out everywhere, St. Thomas, Elmer, and other communities. And when harm reduction was originally put forward as an idea, it was, first off, it was supervised injection sites.
Right.
So it was never safe supply. It was never giving people drugs. And the rationale behind it was always we need to keep people alive long enough to get them into treatment. And I saw there was a big concerning trend that I have seen in some spaces that is really amounting to normalizing drug use as a lifestyle. And I don't think that's helping communities. And I think that the federal model over much of the last few years we've seen fail. And this is something that we saw looking at British Columbia, going back there, where the federal government authorized a pilot project to decriminalize drug use in public. And it has not made overdoses go down. It has not made drug use go down. And British Columbia has now reversed course on this and said, okay, we don't want to do this. So I think on one hand, that's a good sign, because what we should be doing in this space is listening to the experts, looking at what's happening and adjusting. And I think we have seen in more and more situations, Alberta is doing this, Ontario is doing this. And I think federally we're getting there, looking at recovery as being the ultimate goal. And all of our responses to this issue have to lead towards, how do we get people off drugs?
Right.
And the crucial part here is that no one is served by a life of addiction.
Right.
And people are not living their full life. They're not living their free life,
right,
by being, encumbered by addiction. And I think all paths need to lead to getting people off drugs.
Sure. Absolutely.